strongly laid out. Stay with me, Steve. I want to bring in Andy Slavitt, who ran the Medicare and Medicaid services, and Dr. Lipi Roy, an internal medicine physician in New York, who is one of our medical contributors. Good to see you both. Dr. Roy, your views.
Hey, Ari, it's good to be with you again. So a few things that are still deeply concerning to medical and public health professionals. These outbreaks of protests that are happening all over the country. It's deeply concerning because, as I've stated many times before, this is an infectious pathogen that does not discriminate based on political affiliation or color of skin or age. This is going to affect all people from all walks of life. We've already been seeing that, right? So the concern that we all have on the medical side is that 1, 2, 3 weeks from now, we're going to see, we anticipate we're going to see a surge of patients going into the hospitals in these various communities, whether it be Michigan, Mississippi, Texas, wherever. And that's really concerning. Until we have widespread testing and contact tracing, we just don't know what the scope of the problem is in terms of who's infected, who's a carrier, and who's possibly immune. Right. So that's what's concerning.
Let me bring in Andy as well on a medical piece of this. Andy, we try to keep track of everything. One of the ways that this government has run under the president is to throw so much out there that people forget to fact check past falsehoods. We try to avoid that error. And so, Andy, I want to put up on the screen here this malaria-style drug that the president had promoted. He famously said, "What do you have to lose?" Well, here's how that's going. AP reporting more deaths, no benefit from this Virginia study. 28% who were given it died, 11% of those with routine care. By contrast, the lower death rate, it didn't make a difference in the need for a breathing machine. And again, this is incremental evidence. This is why you do studies. But according to the readout of one study, it may have damaged other organs. Andy, given your knowledge of both the way medicine works in the federal government and the reason that there are processes in place, I'm curious if you could walk us through something that some viewers will remember and others may not recall, which is the president went out during this briefing previously and told everyone, yeah, try this thing. What have you got to lose?
I'm about to say what you and your viewers might consider to be the most foolish thing you've ever heard, which is now would be a wonderful time for the president to show some humility. This is a virus that nobody understands. This is a virus that we've never seen before. We have no immunity for. We have literally hundreds and hundreds of papers that are not peer reviewed. We have yet no double-blind trials in place. So there's a lot more that we don't know than we do know. In 10 years, we'll know a lot about this virus. Maybe in 6 months, we'll know a lot about this virus. But the worst thing we could do is have non-scientific people clutching at straws, telling people things that they have absolutely no basis in doing. It'd be perfectly fine for the president to come out and say, there's a lot we don't know. Here is all the data we have. We're going to get the greatest scientists and the greatest minds working on this problem. And I'm going to show my optimism by engaging our country in solving this problem, instead of trying to pass off something that I heard on the back of my head might be good news, but I brought no skepticism to. I don't think we should let him get away with that. And if he does get away with that, I don't think the public, for their own health, ought to be listening to that.
Right. I mean, get away with it is a question of how this information continues to percolate, because I'm going to play a little more of this for your reaction. Steve, the question with any situation like this, whether it's viral or whether it's informational, does boil down to inoculation. And it is perhaps a sad observation that as part of the public health strategy of the United States, experts are telling us that people need to have information inoculation from what they hear from that podium, that what you hear from Dr. Fauci is something you can act on, and what you hear at times from the president you have to inoculate against. Steve, take a look at the president being pressed on this.
I'm wondering if you're concerned, this VA study showed that actually more people died that used the drug that didn't. And I'm wondering if Governor Cuomo brought you back any results.
No, we didn't discuss it, and I don't know of the report. Obviously, there have been some very good reports, and perhaps this one's not a good report, but we'll be looking at it. We'll have a comment on it.
A panel of experts at the NIH is actually now recommending against the use of hydroxychloroquine in combination with Z-Pak, which is something you've
we'll
been
take a look at
recommending.
it. I'm always willing to take a look.
Steve?
Well, exactly. I mean, the first issue is, why is the president of the United States standing behind a podium and giving opinions on what medication to take with regard to a virus that's a novel coronavirus? It's extraordinary. It's the plot out of Contagion with Jude Law, the huckster, trying to sell Persithia to the people who are dealing with the disease in the fictionalized movie. It's just outrageous that the president did that. And now we have some scientific findings that show that, again, he was trying to survive the moment, trying to deliver happy talk, trying to sustain, I guess, his sense of whether he's winning or losing that day. We've read accounts that his view of the White House and the presidency is that it's a reality show and each day is a new episode. Now, Little John and Meatloaf can be fighting one day and be enemies the next on The Apprentice, but it doesn't work that way in real life. So there's an accumulation of all of this that comes together. And so what we see is the most inept response in American history to a life and death crisis by an American leader. And so every day, the president of the United States gets up there and he misinforms the public. He misinforms the public purposefully. He does it for politics, the finger pointing, the blame gaming, the campaign that's ahead. We can look forward to a ceaseless string of race baiting, nationalism, populism, finger pointing, blame gaming about all of this. And this is the warm up that we see playing out at 6 o'clock every night by a president who refuses to accept responsibility, to accept culpability at all on anything, in particular this. But here's the reality. Everything that he said and he did on videotape. And it's going to be very difficult, I think, for him to walk away from all of the misleading things he said over time as the American people deal with the consequences of all of this.
Well, you know, Steve Schmidt, even by the standards of Steve Schmidt, you are on a roll. Dr. Roy, you have Steve bringing in Jude Law's character in Contagion, Meatloaf, and Lil Jon. To quote Lil Jon, I would say I'm putting my hands up for Steve, who ties it all together. If these weren't such serious times, I would say even more about that, but we try to stay as grounded as possible. I'm about to bring in and turn to a governor in our broadcast, our special coverage. So before I do that, Dr. Roy, what is important in your view for folks to understand about the next week or two period as we hear about, on the one hand, some flattening, but on the other, so many states struggling?
First of all, I can't compete with Steve Schmidt's knowledge of television and film, although I'm a big fan. But I just want to just a quick follow-up. Words really matter. So when a person without any medical or scientific training talks casually and recommends casually a medication, it has adverse consequences to people who really listen to him. Nothing we do in medicine is 100% benign. Acetaminophen, or commercially known as Tylenol, an over-the-counter medication that people usually take fairly safely, also happens to be the leading cause of acute liver failure in this country. Everything we do in medicine is a trade-off. So I just want to add that point. The other key point that we need to really recognize, and one of many lessons we need to learn from this pandemic, is that we need to really invest in public health. The United States, since 2010, has invested $180 billion a year on counterterrorism. In contrast, on pandemic response and infectious disease response, 2 billion. 185 or 180 versus 2 billion. In contrast, since in 2019, Congress has appropriated $685 billion to the Pentagon. CDC got 685 versus 7 billion. That's telling you where your taxpayer dollars and my taxpayer dollars are going. So these are the questions we need to be asking.
My thanks to Dr. Roy, Andy Slavitt, and Steve Schmidt, each of you.